Hi everyone, welcome to Therapy Talk. I'm Michael Baltimore, and today we're going to talk about clinical supervision. You know, I really have a belief over that has started a while back, but the belief is simply that we don't prepare enough for clinical supervision. If we're a counselor or counselor in training, that sometimes we're not ready. We want to get in there and talk about cases and do those kinds of things to improve our service to clients. But maybe we haven't done what we need to do to get the most out of clinical supervision. So one of the things I've done over the years in training counselors is to prepare a document called Preparing for Clinical Supervision. And so this is exactly what I've done, and I want to share that with you today. There are 20 points. I want to go over each one of those very quickly for you, and hopefully it will be helpful in your work. So this is my presentation today, and let's go ahead and get started. So if you're preparing for supervision, you want to make the most of it. You want to enhance your clinical experience, and you want to be completely prepared for those things. So I prepared 20 of them. Let's take a look. Here's the first one. Use the skills that you've learned. Basic helping skills are fundamental in building any relationship. And this includes your supervisor, the staff you work with, your colleagues at the placement site or at the work site, the university faculty if they're involved. You want to listen carefully. You want to reflect on what you've heard. You want to be thoughtful in your comments, and you want to respond empathically and in a professional manner. All right, that's one. Let's go to two. Build a positive relationship at the beginning. This guideline holds true for any relationship, but especially applies to working with your supervisor. Be prepared to learn, question, and further your clinical knowledge, and really set up a good supervisory relationship. Number three, be prompt. Always be on time for your supervision meetings. If there's an emergency or a delay, call in advance. Use the same courtesy that you would for your clients, your colleagues, at your work site, and particularly with your supervisors. Number four, record your sessions. Have tape ready for supervision. Now, we all know that this is difficult, and there are times when the setting may not allow you to do those types of recordings, but in training it is required, and there's no better way. You know, one thing that comes to mind is that what I've heard a long time ago is that self-report of your clinical work is the poorest form, the least valid and reliable form of information to the supervisor. So record those sessions, even if it's an audio session, but even better if it's a video session. So once you've done that, take a look at those recordings of your session. Move to the point in the tape or the recording that you want to have your questions answered by the supervisor. Number five, be open to feedback. During supervision, you will receive positive and critical feedback to improve your counseling skills. Be open to looking closely at yourself in the process. There are lots of reasons for this. Use this evaluation to improve your work. So be ready for feedback. Number six, prepare questions for supervision. Now, this sounds like a simple idea, but from the point of view of the case, you don't want to do this in the spur of the moment. It really should reflect your involvement with the client, your involvement with the supervisor, your involvement with the overall process of the clinical experience. Make sure that you have questions that relate to a number of things, including not just the case, but administrative issues, theoretical orientation, the interventions that you use, and remember that supervision is about your professional growth. Number seven, develop your theoretical orientation. Give thoughtful reflection to your personality style and the counseling theories that you've learned. Develop your theoretical orientation. That development is extremely important. You should know a number of the theories that are out there and be comfortable with those. Supervisors will want you to use those theoretical principles. Be prepared for a question from your supervisor concerning your approach. I know that one thing I do sometimes during a session, whether it's a live session behind the mirror or it's a recorded session, is stop and ask the question, of the clinician, what were you doing in that moment? What were you thinking about? What was going on with you? And so I think these are the kind of things you should be prepared for in supervision. That was number 7. Let's go to number 8. You are working for the client. It's important to know that your major responsibility is to the client. While you're developing your professional skill, there is lots of ways that you can help your client. Consider this always and often. Number 9, be professional at all times. Alfred Adler once said to act as if. While it's true that you're a counselor in training or maybe a beginning therapist, it is expected that you offer your professionalism to each and every client that comes in on your caseload. This holds true for all of the other professional relationships, whether it's at the university or your workplace. Number 10, know your ethics. Reread your ethical standards and know them well. You'll be called on to provide sound ethical responses to both clients and supervisors, and this cannot be stressed enough. Consult with other professionals, number 11. This suggestion includes talking to colleagues, staff members, and supervisors as a means of providing sound clinical judgments. So, ask questions. I guess just earlier we talked about having those questions ready. Number 12, read and continue your studies. This is a central concept for improving your clinical skills as a counselor. You must know about what's going on and what it's about to be a professional helper. You should keep current with the literature, journals, books. These will help you in so many ways. Number 13, know that supervision is necessary and valuable throughout your career. It's a lifelong learning process. All counseling professionals require ongoing supervision to maintain their quality of care for the clients. Look forward to the supervision process and the learning process, and be efficient and up to date on your knowledge. Number 14, know that problems arise and should be worked through. Know the difference between your personal reactiveness and professional matters. You need to be compassionate in your dealing with others. Know how you use defenses and work towards successful resolutions of these difficulties during your practicum, your internship, any clinical experience, and of course in your professional work after graduation. Number 15, reflect on your personal background. Seasoned clinicians know that their family of origin and their personal backgrounds affect their clinical work. Understand also that it's this understanding that is the clinical basis and how it will form your interpersonal perception of the case. Supervisors can help you when this comes into play. Number 16, be flexible. Well, this is a nice one. Understand that becoming a professional helper requires your ability to understand that situations may change. Before getting emotionally involved with matters that affect your professional growth, use supervision for a better understanding. Be willing to look at your critical process. Number 17, have fun. Well, this is an interesting one. It's essential for counselors to use humor in their practice, and at the same time, students should limit the use of humor in their clinical work. The caution here is that too much humor can be problematic. Let's go to number 18. Work hard. We just talked about having fun and using humor. This one is use your time wisely. Practicum and internship, that clinical experience is important for setting the stages for the rest of your clinical career. Be creative in the learning process, and while under supervision, try to work your way into improving your clinical work at every turn. Number 19, 2 more to go. Be organized and record your time. Keep good records of your clinical work and your case management and all of the activities throughout your career. You need to maintain these files for a number of activities. You need to make sure that you keep a portfolio. If you're becoming licensed, this is required, but not only that, but after licensure, you are responsible for your continuing education to maintain your license. It's a great habit that you start with good records and you maintain that throughout your professional career. Let's look at the last one, number 20. Reflect on your personal background. You know, seasoned clinicians know that their family of origin, personal backgrounds affect their work. You got to understand that your view of a particular clinical case is based on your interpersonal perception. Supervisors can help you with that work. I want to thank you for tuning in today. That's been 20 ideas for preparing for supervision. I want to thank you for tuning in to Therapy Talk. I'm Michael Baltimore, and I'll see you next time here on Therapy Talk.